Welcome to Continuum, a podcast dedicated to your health. We'll introduce you to individuals throughout the healthcare world, from patients to providers, with a focus on inspiration and education. In this episode, Mandy Bodily-bartrum and Darla Perdue join us to discuss the recent coronavirus outbreak. Mandy is the Vice President of Infection Prevention at Vibra Healthcare, and Darla is Vibra's Chief Clinical Officer. Mandy and Darla are on the forefront of protecting the patients and staff in Vibra's hospitals from the virus. They explain what the coronavirus is, how it is transmitted, and what can be done to protect yourself and your loved ones. Welcome everybody. If you've been paying attention to the news at all, you have certainly heard of the coronavirus. And today we wanted to address some of the common questions surrounding coronavirus. And with me today, I have Mandy Bodily-bartrum, DNP, MPH, RN, CIC, FAPIC. I'm not trying to be awful at a spelling bee. Those are Mandy's credentials. And basically, Mandy looks after infection control. Mandy, what is your official title?
My official title is Vice President of Infection Prevention.
Fantastic. Thank you. And then I also have the pleasure in studio, I have Darla Perdue, MS and RN, and she is our Chief Clinical Officer for all Vibra hospitals. And between her and Mandy, we're going to get to the bottom of what's going on with coronavirus. And I really appreciate both of you taking the time. You're always really busy, and these days you're extra busy. And let's just crack right into it. What is a coronavirus?
Yeah, so this is Mandy. So coronaviruses are really just viruses that we have found that affect humans and animals. And coronavirus, the name of the coronavirus, is actually based on the structure. So if you're looking at it through a microscope, it looks like there's little crowns on their surface. So that's why it's named the coronavirus. And according to CDC, human coronaviruses were identified in the 1960s. And there are several coronavirus types that affect humans. There's about 7 or 8. And you may recall SARS or MERS.
Sure, yeah.
And those are also coronaviruses that have affected humans.
There's way more to it already than I thought there would be. So I heard a rumor that the virus originated from folks eating odd things like bats and things like that. The internet is a fun place. So where did this originate?
Coronaviruses in general, it's a large family of viruses, and they're common in people and different species of animals. Like if you looked at our MERS, we saw a correlation with camels. We looked, sometimes there's cattle, cats, bats. This one, it looks like it has a origin in bats.
Okay.
The sequences are similar in the U.S. as the ones that China is showing. So it does show that it's probably related to an animal reservoir, and more than likely is related to bats in origin.
Okay. So the internet doesn't always lie. I don't know what. Okay.
But it's not based on eating a bat.
Oh, okay. So Ozzy is safe.
Yes.
Okay. All right.
Ozzy is safe. There is no eating of the bat. It's related to droplets of bat excrement, those types of things.
Okay. Oh, it gets gnarly pretty quick. Okay. So Darla, moving on. What is this caused by? Is it literally just somebody decided one day that it'd be a good idea to try a bat dropping, and now we have chaos, or, No,
it's caused from an environmental process.
I see.
So people can pick it up through the environment because of hygienically, people touch things all the time.
Oh, yeah.
They touch their face, and from an exposure, if they picked something up on their hands and they didn't wash their hands appropriately, it can then, if they touch their face, that's how things get spread.
Sure.
Similar to just a flu, a cough, a cold. Those are the same kind of processes.
Okay. So it's obviously airborne. I heard also, again, just you can't exist right now without getting information, whether it's
Absolutely.
legitimate or not. And I think that's why we're here today, too,
Right.
is to really clarify some of these things.
Yes.
So I heard that it can live on surfaces, and I also heard that it can live up to 9 days. Can we validate this on its own? I mean, does it need a host?
So, coronavirus can live on surfaces. The World Health Organization, if you go and look at their information, they're showing that it can live on surfaces for hours up to days. So it really depends on the environment that it's in, whether it can stay alive for that long. It's just like anything else. If it's, there may be environmental factors. But the big thing is keeping your surfaces clean. So if we are cleaning at home or surfaces, and in the hospital setting, of course, we're really looking at cleaning our items and cleaning our high-touch surfaces regularly to reduce bacteria, including coronavirus, but all sorts of things that live in the hospital setting.
Okay,
Correct.
cool.
So one of the things that I want to touch base too is on the high-touch surfaces. The high-touch surface really is related to door handles. Something as simple as the bathroom door handle.
Yeah.
And people don't really realize that touching a door handle, how many people touch a door handle in a day? That's considered a high-touch surface. Yeah. So when you hear about high-touch surfaces being really focused on at a hospital level, it really is something you should be focusing on in your own homes as well.
Right.
So your countertops, anything related to something that you're going to open and close frequently, your cabinet door handles, your refrigerator handle, your stove handle. Those are all things that you do all day long in your day,
and
you're not thinking about it. And how often are you washing your hands before you touch these items? So that's really the process of what we're really focusing on today is learning what it's about. The media has created quite the
as it does
hysteria, unfortunately, and really providing just the simplistic view of if you wash your hands, if you focus on the cleanliness of your environment, you're going to reduce your possibility of being exposed to any infection significantly.
Yeah. So speaking of the media,
yes,
we hear buzzwords like plague, pandemic, mutate, all these things that keep those advertisement dollars coming in for those wonderful networks. It's awesome. So let's just start with plague. How does this rank against something like that? I mean, we're familiar with the Dark Ages in Europe and all that.
Yes.
I mean, are we there? Are we headed there?
So, I mean, as far as, we throw out words like pandemic, we're definitely in an outbreak situation. I think maybe on a verge of a pandemic, but I think, as Darla pointed out, these regular infection prevention measures will help. As far as mutation goes, the World Health Organization did a report on coronavirus or COVID-19, and it showed they looked at an analysis of strains from December 2019 to mid-February, and there's not really showing significant mutation. They showed that most strains that were tested were 99.9% alike. So it's not to say that the virus could not mutate,
right,
but currently we're not seeing that. So I would definitely say that this virus, it's something to be cautious about, but not necessarily to get too panicked about.
Sure.
We've got to be cautious. We've got to be doing our infection prevention measures that we should be doing all the time to prevent spread of infection.
So I want to be careful not to nerd out on viruses too much, but this whole, like, you gave to me, kind of a short window for measuring whether a virus will mutate or not. Are there other viruses out there that like mutate aggressively? What was that? It was like 2.5 months, I think you gave as a window for measurement.
Yeah, I mean, and keep in mind, this virus has only been at least identified for maybe just a little bit longer than that period of time. And certainly there are viruses that do mutate. We see that with HIV and certain other viruses. So it's not to say, again, that it could not mutate, and there is that possibility. So it's just like the flu, those strains are maybe not mutating, but they're different every year.
Right.
So it is something that we just need to be aware of, and CDC is obviously doing a pretty good job of like trying to monitor what's coming into them as far as testing. And there's still a lot of unknowns about the coronavirus just because it is such a novel virus that we are seeing.
Right. So let's talk about what we do know. Symptoms. What are we looking for? If I have coronavirus, how do I know I have coronavirus?
Yeah. So the main symptoms that CDC is telling the general public to be looking out for are fever, cough, and shortness of breath, and they generally start mild and may progress. And this virus is spread through we believe it's spread through droplets. So it's kind of the same way the flu is spread. Not like tuberculosis, which is airborne, but these droplets are excreted when like someone coughs or sneezes, and that can go as far as 6 feet potentially. So that's something to keep in mind, is like social distancing is going to be an important piece. And those droplets, once they come out, then you could either breathe them in or they can fall onto a surface.
Sure.
So those are the things to be looking for. And once somebody's exposed, you could potentially start seeing symptoms at about 2 days after, and then up to 14 or potentially more. I've seen some reports that people have still shown the virus even after the 14-day period. Okay. But again, we're still learning more about how long the novel coronavirus is.
Now, relative to like the common flu, and understood that every case is different and people's perception of pain and discomfort are vary, but let's compare this to the flu. I mean, is it similar in flavor? Or you really kind of know, like, no, this is not influenza. This is something else.
So, I mean, you think about the general signs that they're saying are coronavirus, right? Fever, cough, shortness of breath. Those are flu-like illness kind of symptoms. So it is very similar, and we're still in flu season.
Sure.
So at the tail end, and hopefully we'll be seeing that dissipate, but it is, when you're talking about just general symptoms, I would say they're very similar to the flu, although it does last longer, obviously, for how long that you can shed that virus.
Okay.
And the thing that is different about this is that the current estimates for death rate put the coronavirus at about 2%, which is more than our known death rate for the flu, which you could see anywhere from like 0.1 to 0.6%.
Wow, yeah.
So it is higher. So there are risks, and most of the people that are at the highest risks would be those who have compromised immune systems or those who are older populations are going to be at a higher risk from complications from COVID-19, which could lead to, mortality.
Sure. Now, older population, higher risk, younger population. Does it vary at all for kids with this, or are they in the same boat as all of us, from a general perspective?
So the data on this is kind of quite interesting, actually. So CDC says that children are not more susceptible, and in fact, most of the cases that we've identified of this COVID-19 has occurred in adults. I've seen some news reports from some physicians who even believe that perhaps children can have such mild cases that they're kind of carriers and can be the ones spreading it. I don't know if we have enough information to, stamp that with saying that's absolutely true or not, but definitely the data is showing that younger children are not having this virus with severe symptoms as often.
So young or old, as sure as someone can be that they have coronavirus, what should you do? What are the steps to getting it treated?
Yeah, absolutely. So if you're experiencing coronavirus symptoms and you're worried, if you're mildly ill, stay home. It's just like the flu. No one wants to get your illness.
Yeah.
So restrict activities outside your home except for getting medical care. Try to avoid going out. And then if you're having a medical appointment, call and tell your doctor that you have these symptoms and that you may be concerned about having the COVID-19 infection.
Okay.
And that helps their provider to be able to say, come through the back door and we'll put you right in a room and we'll wear the proper personal protective equipment, masks, etc., to keep you and their providers safe.
Okay.
So if you're in an area where you have to be around people, wearing a face mask if possible so that you aren't spreading those droplets around.
Right.
And just regular cleaning and hand hygiene in your house, making sure that your home is being cleaned regularly, all those good things that we should be doing anyhow.
So let's get a little bit technical, kind of specific to coronavirus. How are they testing for it? What are some of the things that they're doing? I don't know if it's worth mentioning. Is it different than the flu or other things? What's involved with the test?
So I wouldn't say that I am an expert on all of the microbiology specifics, but their testing is currently limited a little bit to certain states. CDC has been sending out test kits, and I know there were some snags with that initially. And CDC was the first one really in our country to be doing those tests. So testing was somewhat limited. And unfortunately, right now, we don't have a general test that's really available for commercial labs. So you can't just go to your doctor, he swabs you like the flu, and then in 5 minutes you know whether you have this COVID-19 or not.
So it's a bit
so
still
it is a
boutique.
special testing regimen that has to be done, and it has to be approved by the health department to do those testing, at least for now. And again, more is coming out, so things may change rapidly as far as the testing protocol.
Right. And so, one of the big questions is it curable? And I think what you've kind of established already is that there's too many unknowns. Did I see today that they're at they may have something ready to test, like some kind of, I don't know. I'll stop there. Yeah.
Vaccine.
Yeah. I swear I saw a headline.
Yeah, there is a lot of information that's being put out there. At this point, there is nothing defined. Okay. They are looking at a vaccine that's similar to like a flu vaccine for this particular virus. Okay. And one of the things that we need to continue to stress to everyone is that it is a virus. The biggest element of protection is hand hygiene and cough etiquette. So if you're going to the grocery store, you get one of those little wipes and you wipe off the handle of the grocery cart.
Yeah.
They're available to you. Managing those pieces will eliminate exposure significantly.
Okay.
And life expectancy, again, this is affecting the older adult, the more vulnerable. The adult that has an immunocompromised system is another individual that is affected.
Sure.
Identifying it, going to the doctor. If you have a fever that is over 101, that's when you're going to seek help.
Yeah.
Right? If you're having a cough and the sniffles, and it is the season, we are in flu season as well, you're really going to take a look at that. Okay, I have a fever, now I have shortness of breath that's getting worse. I need to seek medical attention. So that's kind of how you want to look at this, because you don't want everybody to run to the doctor if they get a cold, because then that's not going to help the situation for anyone that truly has a virus that needs medical care. And that's what we're trying to do is with this conversation today is reduce fear, because unfortunately that's the big thing that we're fighting up against with the media, is that, you know, they're throwing out these numbers and they're giving these statistics, and it is a scary time. But the flu, the general flu, can also cause death as well. So it's not, and as Mandy indicated, currently it's estimated that the 2% of the population that has the COVID-19, it's higher than the regular flu. But again, it's impacting adults that are older adults and that are adults that are very compromised in their health to begin with.
Right. But that said, as we've established, I don't really know anybody that goes around licking shopping carts. But if you're in your mid-30s and you have some reason to do that or want to do that, don't do that. You're not, just because you're not older. So I don't mean to make light of this.
Just don't touch your face if you touch a barking carpet.
Because there are a lot of, I'm sorry, there are a lot of dum-dums out there, and I just want to clarify, just because you're a younger person, that's just not your green light to just continue on being gross.
Correct.
Anyway, well, this is pretty comprehensive to me in terms of getting people the facts in a succinct fashion. I want to thank both of you for taking some time out of your busy day. There are a lot of hospitals that are doing a lot of preparation and precautionary work and education. I've been helping them this week with this as well, and certainly in a hospital environment, the patient population naturally is at risk more than others. So needless to say, a lot of work is being done to mitigate any of this getting its hands on our patients for sure. So with that, Mandy, Darla, anything else to add?
No, I just want to thank you for the opportunity.
Absolutely. It's my pleasure, but more so, I'm really happy you guys stopped by to clarify some of these things. Like I said, between just being plugged into the media, I'm getting all kinds of information. So getting the straight facts, couldn't ask for two better people to come and really, tell it how it is. So again, thank you very much. And with that, till next time, thank you.
Thank you.
Yeah, thank you so much. Appreciate it.
Our guests today were Mandy Bodily-bartrum and Darla Perdue. To learn more about the coronavirus, check out the show notes on the Continuum blog at vibrahealthcare.com/blog. If you enjoyed our conversation with Mandy and Darla, please consider leaving us a review wherever you listen to podcasts, and don't forget to subscribe to receive new episodes as they're released.